My name is Gina Koay. I am a community pharmacist practicing in Penang. So I was registered as mQuit Certified Smoking Cessation Service Provider and as a pharmacist 2 years ago. So it was certified through MPS and MAP, that's Malaysia Academy of Pharmacy by Professor Hani. So I was then recruited to become the mQuit.com platform service provider. So mQuit is actually a platform formed by Ministry of Health Malaysia and collaborated with MPS and also Pemadam. That's actually a Persatuan Penjaga Dadah Malaysia. So in this platform, I was being assigned with patients from Malaysia, mostly from the northern region. Until now, there were around 20 smokers, who was assigned to me to help them to quit smoking. So I do charge a small fee while conducting the coaching session. So I use a telehealth platform because last year it was MCO. So the telehealth platform is actually called Pharmily. So to do the online coaching and consulting sessions. So I took on an extra course a few years ago to become a certified integrative nutrition health coach. So as a health coach, I use holistic approach to coach my patient to become holistically well and healthy in a few areas such as diabetes, obesity, and hypertension, and so on. So when the mQuit program came along through MPS and also MAP platform, so I felt it was just about the right timing to also coach patients who need help to quit smoking. So that's how I'm inspired to take up the course and also subsequently become the mQuit service provider. So I guess that in this platform, the people who will wanting to quit smoking will benefit from there. In the smoking cessation program that we are being, I would say that through the mQuit, we actually use some tools, for example, the Spectrum test, the assessment test for a start for nicotine dependence. In fact, it is a standard instrument, or we call it a tool for assessing the intensity of the physical addiction to nicotine. So before even I start coaching, I'll ask them this first, to actually assess, for example, how many cigarettes do they smoke in a day, and then how many do they actually smoke when they first get up. There are many questions asked them. So the test was actually designed to provide an ordinal measure of nicotine dependence related to cigarette smoking. So from there, I start to assess also their lifestyle, what's their job, what's their profession, and then what makes them want to smoke. And I also help them to do a quit date, and then from there assess their needs. How can I help them to smoking? So of course, on top of that, there are also medicine, as you know, control medicine available to help with withdrawal in patients. So such as the patch, the gum, and also the tablets. So in mQuit platform, there are also the tablets available through the I would say the KK or the GH. So it depends where they are. So these are our public facilities, and also in fact give them free. Up to certain limit, maybe give them a month or so free. Then after that, they probably have to get it from the private sector. And then the gum and the patch, normally I think some may be given, but sometimes they actually have to buy out, so-called buy out. That means get it in the private sector, such as the community pharmacists. So these are the nicotine replacement therapy. We help them. Some of them actually refuse to use also, and so I had to use other methods to actually help them with smoking. Okay, the commonly just now I mentioned there's a gum, there's a patch, and also there's a tablet. So the very popular brand, I think everyone is aware, is the Nicorette, Nicorette brand. In fact, they have a range of the products designed to support the smokers, okay, while they give up smoking. So the products is actually a nicotine replacement, so they won't feel the cold turkey that I call it. So it's actually step down gradually. So they help to relieve the withdrawal symptoms and reduce the nicotine craving, which they can experience when they first stop smoking. And they can also help them to cut down the number of cigarettes they smoke. So that's how the correct, let's say the patch, okay, it actually called the correct Invisi transdermal patch. It's actually once a day, and they have 3 steps. So it's like the nicotine actually absorbed directly into your bloodstream, and it doesn't interfere with your sleep. So it can control up to 16 hours of craving. So there are 3 types. I think there are 25 milligram, 50 milligram, and 10 milligram available. Okay, that's the patch. The second one is actually the mint. They call it the icy mint gum. Sorry, it's a gum. So you can actually chew, and then they pack on the side. And they after that they chew again. So again, it actually works very fast to relieve the cravings and the withdrawal symptoms. It comes in 2 milligram or 4 milligram to let them choose. Okay. Based on how many cigarettes they smoke in a day. So the final one is actually Champix. That's quite a famous one. It contains this varenicline tartrate. It's actually quite technical. So it's actually affect how the brain receptor, you call it the neuronal nicotine acetylcysteine receptor. So it added a partial agonist compound. Actually also antagonist activity in the presence of nicotine, and somehow this is just a pharmacology part of it. So they actually have a dosage guide that they have to take. So for me, I actually guide them on how to really start the medicine, and after that titrate it so they can eventually quit smoking. In fact, there are many successful cases of them using the tablet and quit smoking. So I believe that the traditional way, I believe they also work, but I'm not an expert in that because it's meditation. In fact, if a person wanted to quit smoking, until they are very ready, so those that came to the platform, the so-called Jom Quit platform, they have the courage to actually click and they say they want to quit. Okay, so this is how we get a pool of people who wanted to quit smoking in that platform. And because quit smoking, you need a lot of courage and consistency. So I believe that, let's say, you're talking about meditation, acupuncture and all that, you do. I believe that in some ways that I've heard people say that, oh, it does work, and all that. For health coaching and consultation purpose, I also use a method called the CBT. It's more into psychological part of it. It's cognitive behavioral therapy. It's actually also being taught inside our program, in mQuit program. So it's more like talking therapy that can help one to manage a problem by changing the way they think and behave. So that's how throughout the program I had to ask a lot of questions, and throughout that, normally I would say half an hour session. A lot of time I'm the one who has to do a lot of talking. So I have to assess them, have to get them to agree, ask them really can they commit, what are the things they can do, Let's say I don't want any NRT, I wanted using my own perseverance and my need to quit, you see. So a lot of them I have to assess and really hold them. Otherwise, they will say that, oh, next year I don't want to see you, So they have to consistent. A lot of them actually need a lot of encouragement, okay, and inspiration. They need to inspire, why they need to quit smoking and all that. So we just want to hold hands with them, so that they can quit step by step and slowly, but truly, okay. So so that they will not, halfway they say they can't do it. Of course, there are people who has that. They say I'm very busy, and all that. But at the end of the day, I do ask them, why they want to quit smoking at the first time. They need to go back to the why. So there's actually a lot of talking in between. It's not just an NRT patch on their body and you expect the NRT to work wonders. Of course, it helps, but a lot of this motivation, encouragement, and the persistence the person need to have so that they can quit the smoking successfully. So that's why commonly it may take 2 to 3 months. Okay, if one can follow me for 2 to 3 months and did it, I think it's very successful already. Yeah. So as I mentioned, I usually do an assessment to them first. Okay, the Fagerstrom test. Okay, and I check their history. Ask them what their patient history. For example, do they take any other medicine? Some may be taking an antidepressant already. Of course, they have to be truthful, They have to really tell you. And also, do they have, if they are taking any other supplements, okay, do they suffer from any other health issues? Okay, so these are the, I would say that consideration, whether or not they fit to really do it. Sometimes, because people who want to quit smoking is from all walks of life, okay. It could be a professor, okay. It could be an engineer. It could be a businessman. There's so many people. Most of them are actually male, though. So many I coach. They are mostly male and different race or so, Then of course, a lot of time I really need to understand the person well first, before we really wanted to, make it a point. Because we don't meet in real life, like they don't come to my pharmacy and meet. But a lot of time, like now, okay, we do online online sessions. So that's why you wanted to talk to someone face to face like that. It does take some time to really, get their agreement, their trust and all that, put the rapport before they really say, okay, I will do it, that kind of thing. Okay, of course, as I said, we don't really meet face to face. So I do a lot of follow up in between. I have to see their response, okay, and some of them actually I call them because sometimes they are working, they cannot, reach the phone. So I text them. They have to reply, if a person really wanted to do it, then they have to reply, because they understand that I come from the platform, as someone, and then I'm a pharmacist also at the same time, I'm trying to help them to quit, by following up so many people at the same time. It's actually not easy. We have a lot of time also. But the thing is, because sometimes some people may just say that I don't have time, who are you, that kind of thing. So for these people, again, once they understand that where they're coming from, what they really want to do. So I'll also look back their current lifestyle, profession, current job, stress factor and all that. So sometimes, they may just do and they show you their result. I already quit smoking from how many pieces to how many pieces, of the cigarettes. And at the end, let's say they have already gone down to 1 or 2, means they're quite successful already. So they may just, that's it, I don't want to smoke anymore. Or some of them just still struggling, It may take them weeks to even respond, some of them. Okay, some of them will just forget about it. Even I follow up many times, they will say, no. So sometimes I call them and all that until they say no to me. So if they say, sorry, I don't want, what can you do? Maybe they are not ready yet, Maybe they're halfway ready. Then they start to have stress at work. Then they will think of the cigarette as the fast relief. Then they forgot about why they want to quit smoking, the benefits of quitting and all that. So that's why it's about a follow-up job, and also how they really wanted to listen to you, to really gain back their, the rapport, the trust and everything, to hold their hands together, so-called hold their hands, like really, understand the situation and coach them step by step to really they have done it at the end of the day. So of course, as you know, by quit smoking, you can lengthen your life expectancy, okay? Decrease the risk of certain diseases such as the lung cancer is very common. You can see even in a pack of cigarettes, okay? Certain heart diseases, high blood pressure, even ulcers in your mouth. Okay, I've seen that teeth are yellow. How about the nose? They can have all these. The hands are maybe different color and all that. Um, Sexual dysfunction, kidney disease. There are so many conditions that in fact you can reduce the risk of it by quit smoking. It may add as much as 10 years of life, quality of life. We call it improving your health span rather than just normal lifespan. Okay, so you wanted the quality of life later on rather than smoking. As you know, smoking is very toxic because it has so much nicotine, and on top of it, it has also a lot of other junk. So-called junk means the chemical. So bit by bit, it's actually adding it into your lungs. So I really urge those that still sitting on a bench, on still want or you don't want, I really urge you to really take action now. And to me, it's never too late. It's like, let's say someone say, I'm 50 years old already, it's too late. No, it's never too late to quit smoking. So no matter how old you are or how long you've been quitting smoking or wanted to quit smoking, so at any time of that, when you quit, you really, really add years to your life, breathe more easily, and even help, the family members around you, okay? Because some may have little ones coming up, babies, children, and all that, can actually help to improve their life. So, and also you may have more energy after you quit smoking, and at the end of the day, it may save you a lot of money because cigarette or even vape and everything, it costs a lot of money to maintain it. So just take action.